Bonjour à tous.
Good afternoon and welcome to this session entitled How We Should Reconsider Health on an International Scale. Pandemics know no borders. We've clearly seen that during the COVID-19 crisis. But despite that, there's been a lot of withdrawal and some nationalism. And the WHO has been criticized. Trump has decided not to fund it anymore. The pandemic seems to be slowing down. In Europe, it seems to be contained, but it is still fierce and developing in the US and in Brazil. So should we look at health as on an international scale? How can we draw the lessons from this crisis? How could health systems better cooperate? And how can we look at health as a public good, even though budgets are under strain? So, Christian Clot, you are an explorer, so you've actually gone to Patagonia, to deserts, and so you've played poker with death on all your exploring visits and travels. So you'll tell us more about human resilience. We're still trying to get Sylvie online. She is a specialist in infectious diseases, and she works at the WHO, at the Department of Global Infections, and she'll tell us whether the WHO needs to be reformed or not. Martin Fitchett, he's the global head of the global public health at Johnson & Johnson, one of the leaders in pharmaceutical companies. So you can tell us where we stand in terms of research in vaccines. And you're talking to us from Basel in Switzerland, sorry. Ms. GHOSH, you are the head of global policy and advocacy at the Bill and Melinda Gates Foundation, and you are talking to us from Vancouver in Canada. Yvonne MBURU, you are Kenyan. You are a researcher in immunology. You founded the Exactly. It's a professional network of African professionals, and you also sit on the Presidential Council for Africa that has been created by Mr. Macron. And you are talking to us from Nairobi, Kenyan capital. Tilman RUFF is not with us, but he's been interviewed. In anticipation, he works in the hospital in Melbourne, and he's a specialist in viruses, and he's done a lot of work to fight the spread of nuclear weapons. And I have next to me Isabelle, MEJEAN. She's an economist. She's a member of the Cercle des économistes, and she's been awarded the she been granted an award of the Young Economist of the Year. So I give you the floor first for an introductory presentation. Well, this crisis has compelled us to rethink health as a common good that we need to defend. We've seen that the health situation of all countries, be they developing or developed, has become the main topic discussed by all our heads of governments. It's revived criticisms over globalization and free movement of people, but what the crisis has shed light on is first and foremost the necessity to look at public health as a public good on an international scale when our health policies are still national policies, including in Europe. We've heard a number of calls for cooperation in research and financing of vaccines, notably, but we've also seen that the fact that the US left the WHO demonstrated that management of health on a global scale depends on a number of political and budgetary factors. So during this panel discussion, we wanted to have a great degree of diversity amongst our panelists to look at different topics. Does globalization make pandemics worse, or does globalization make for more globalized cooperation and international cooperation? How can we organize our health systems so as to have a more efficient response to pandemics that of course, are international. How can we protect that common good that is health in a context and an environment that is still going to have a lot of budgetary constraints? Thank you, Isabelle. Lots of questions. Let's start with Tilman RUFF. He is an Australian doctor specialist in infectious diseases, and he'll explain why the world should be better prepared faced with world pandemics. This interview was recorded a couple of days ago. Because of the time difference, it was hard to have him with us. Let's listen to Tilman RUFF.
Thank you for inviting me to join this meeting. I'm delighted to join you, even if it is virtual, but that's very much better than not being able to join you. So the questions I've been asked to address are really quite substantial and challenging at this time. Why reconsidering global health? Well, I think health is a perennial challenge, and now in the middle of a global pandemic, it's really brought health to the fore in such a powerful way, really everywhere in the world. I mean, it is one of the most central and crucial realities of human life, and an area in which so many spectacular gains have been made in terms of life expectancy and health outcomes. It's a universal shared concern of people all over the world. The COVID crisis and the response to it, I think, has taught us a large number of things. We've seen very diverse responses. Some of the wealthiest countries, some of the most arrogant leaders have really been brought low by this small virus. Other countries, not the richest, have done very well. And other regions in countries, Kerala in India, for example, Vietnam, Taiwan, have done extremely well, often out of disproportion to their income, not the wealthiest countries. I think the pandemic has really shown us that new pathogens and new infectious diseases will always continue to emerge. And indeed, that is accelerating because of the massive movement of people and goods in the modern world at great speed, the industrial farming, the loss of habitat that brings wild animals closer to farmed animals, the widespread use of human antibiotics in the veterinary world. All of these things make pandemics, which have always been with us, more likely. So that makes preparing for them even more important. And despite repeated warnings after the Ebola pandemic, after the flu pandemic in 2009-10, many authorities warned we need to be better prepared for pandemics. And mostly, unfortunately, that advice wasn't heeded. I really hope we heed it this time. But it really does highlight our interconnected vulnerabilities and capacities, that our real security lies not in military security, but in secure livelihoods and incomes and health and security for everybody in the world. Respect for evidence and the experts that are the custodians of it has really been crucial part of the effective responses to this pandemic. Changes that we thought couldn't be made or only with great difficulty have been made very quickly. For example, doing most international conferences by Zoom, it really has proven actually so easy. We've really seen, I think, quite strikingly, that I think quite disproportionately female leaders have generally been more sensible and reliable in this crisis than male leaders. I think there are some lessons there. I think we've seen remarkable ingenuity and resourcefulness and kindness all around the world. And I'm really reminded about how fragile our life and health is every day, that we really need to take nothing for granted. And there are two fundamental preconditions to securing life and health for all of us that could otherwise jeopardize all the gains we made. And these are two twin challenges really to the stable and hospitable climate that we need. One is, of course, the global heating, which is already upon us. And the other is the threat of indiscriminate nuclear violence from nuclear weapons. This danger is growing. We need to eliminate these weapons as a matter of urgency, just as we need to address global heating. And these will be really the two factors that are the big overarching issues that determine the future health of the world when we move beyond this pandemic, as we will. How can we build a better system? I'll just offer a couple of thoughts about the World Health Organization, because it is such a crucial organization. And if we didn't have it, we would certainly need to reinvent it every year. I have worked with WHO quite a bit, especially in immunization in the Western Pacific region, in my region. And I'm always struck by what a small number of dedicated people can actually accomplish. WHO's budget is less than $4 billion per year, and only less than 1/4 of that is actually guaranteed by the regular fixed commitments that governments make to the UN. So most of that, more than 3/4 of it, WHO has to go begging, and that seriously constrains its capacity. So WHO needs much better resourcing and much better fixed resourcing that is secure from year on year, that it doesn't have to go begging, that really allows it to plan and mobilize and harness the expertise that it needs. Thanks very much.
Merci Tilman, RUFF. Donc cette interview est...
Thank you, Tilman, RUFF. This was recorded. Christian Claude, I'd like to have you react. Mr. Tilman talk about the climate, global warming, and the way we can better. Yeah, there is a huge echo, says Madame. Yes, we do have an echo in the so. Well, there is. It talks. It demonstrates the vulnerability of systems, and it's just that we're surprised that in Taiwan it's better. They did better in Europe, but there was a COVADAPT study with the Human Adaptation Institute to see how population adapted themselves to lockdown. And now, is health first and foremost an issue of brain, and it is universal? Yes. Good afternoon. I'm very happy to be here to discuss this topic. And as Mr. Tilman said earlier on, of course, there is an obvious dimension which forget to take into account when we talk about medical in terms of healthcare, is the environmental dimension. Clearly, to do that, this pandemic, this came because there was a reduction of habitat of human species, and we have to change the human cognitive paradigm. You know, I'll try to have 3 points which are fundamental today. So not just to recover from disease that exists, but of a new disease. There is the environmental aspect, and today we have to act. You cannot separate health and environment, either because we invade the space of wild animals, because global warming is releasing with you've seen, for example, diseases that came back, and it's due to the melting of the permafrost in Siberia. So there will be more viruses. Well, more animals should not cohabit with us. That will be, and because there will be also results coming from nature and the melting and other thawing. Well, we don't take into account mental health. We talk about drugs, we talk about vaccines, but we don't take into account mental health and a change of cognitive paradigm necessary today to make things change. Just an example, during lockdown, we did confine almost half of the world, but didn't think about the impact of this. So with COVADAPT, with my institute, we did research. 20% of the population, just in France, 13 million people who've been impacted significantly after the lockdown. Nobody talks about it, but the people who in the world, because of the economic crisis, have been very fragilized. We've done everything so that the medical world did the best, but million people who are dying of hunger, poor health, sanitation. Well, we don't talk about that. You're saying we have a too restrictive vision of health, and I'm sure that we'll hear what's happening in Africa or the fragility of population. When I said that India did better, well, maybe the viral possibly, but at what price, in the human price, in the slums in India? So we really have to take into account this change of paradigm. And I'd like to know how foundations like Bill and Melinda Gates, for example, foundation, it's all very well to pay attention to viruses and so on and so forth, but how you deal with mental health, and I'm sure I hope we'll have explanation from that, from Mr. GHOSH. Now, and Mrs. GHOSH, and we have to recreate the international cooperation. You know, the virus, you know, means that we were locked in our borders. You know, we saw actually countries stealing masks from other countries. So we have to restore cooperation, solidarity. A little note published by the WHO, which shows that it was not only China that warned China. It was actually the WHO which questioned China. So I'm sorry that we don't have any representative from the UN today. You know, how is it possible today to create new cooperative solidarity so that we don't face the same problem again? Sylvie Briand, are you with us from Geneva or not? Yes, good afternoon. We are happy to have you again. Now, you are the WHO representative, you're a doctor. The WHO was highly criticized. Donald Trump sort of, cut all ties with you. So is this pandemic a demonstration of how states and institutions cannot cooperate? Yes and no. First, I think this crisis is like every other crisis. I mean, usually they're more localized, like Ebola in 2014 or Zika in 2016. Well, those are crises will fuel fear, anxiety, disorders in social or societal structures, and this crisis is no exception to the rule. Yet, what this crisis is demonstrating is the crisis of multilateralism, of a vision of the world where countries work together on health issues. For example, in the 70s, 80s, despite the Cold War, countries were able to get together to eradicate smallpox. Now, if we had this type of endeavor, global endeavor, you know, to eradicate a disease or to fight a disease, we'll see it's far more difficult to do. So WHO does not stop collaboration. Well, WHO has a mandate to be a collaborator, the leader, you know, in the member states renewed the international sanitary regulation, which, well, the previous version had been adopted in 1969. It's been modernized. We've added a lot of things which were not in the initial version. So we do have a theoretical international mandate, and therefore we are able to detect diseases because as the previous speaker said, it is our system that makes it possible to detect signals, and then signs of pandemics, and we ask the countries to give us more information about those signals. So we do have a system that works, but indeed, when it comes to having a coordinated answer, it's very complicated. So, and I think it reflects the state of the world. That is basically, this is a, well, liberal economy is based on competition, and not on solidarity, let's face it. So to implement solidarity principles for domains like healthcare, well, it's more complicated. And there is an issue of resources, $4 billion budget, $4 billion US dollar budget, you know, and with, yeah, it's, well, we still have a strong mandate, even if we have only one quarter. We have 94 member states which have, you know, giving us the mandate. So it's a major one, but indeed, little means to implement it, limited budget. And we do have we have very major technical activity. We developed norms, standards, technical guides or guidelines, and we have a little staff to do so. Not enough staff. So it is, you're the victim of political strife. Yeah, well, or rivalry. Well, yeah, this debate now, you know, for example, the hydroxychloroquine on the mask or modes of transmission and so on and so forth. All those issues, of course, are complicating the process. And and the implementation of our action, because we're dealing with a new disease, and we knew almost nothing about it a few months ago, even though science is making headways fast. But still, like any scientific process, we can never achieve truth at once. Many steps are needed before we, what is going on can be understood. So, in the scientific committee, there are discussions, debates, controversy, but that's part of the learning process and updating process of reality through the scientific committees. But such discussions are often instrumentalized, used for other purposes, and it is complicated to establish standards or guidelines that will be adopted by people or countries. Especially that, the scientific time is not the political time. Exactly, you're right. Martin FITCHET. You work for a US pharmaceutical giant. Where do you stand now? You're in Basel, in Switzerland. So where do you stand in terms of research of vaccine against COVID? Are you going to start clinical trial? You're going to start clinical trial this month, right? So there is fierce competition between labs. Will collaboration be good enough so that the vaccine will be accessible to all? Your answer.
Stephanie, firstly, thank you for the invitation to join this wonderful forum. I just want to comment on the concept of collaboration, because it's been actively debated for the last 15 minutes. And from where I sit in the scientific region, it doesn't actually too bad. And I think I can report that the diplomacy of science is alive and well. If we think about how this whole the scientific endeavor began in terms of the road to the vaccine, it was with the sharing of a genetic code, the genetic information on the virus by Chinese researchers. That allowed us and many other companies and government institutions and other bodies to begin research immediately on trying to sequence the virus and begin to produce the vaccine. And so I think that is very positive. The collaboration that we have witnessed has been absolutely unprecedented at the R&D scale, the scientific scale, the sharing of information, working between companies, between government institutions, health institutes, academic groups, as well as governments, has been really deep and unprecedented. And I think that's a very positive part of the story. Now, in terms of our vaccine, absolutely, as you say, things are progressing well. And indeed, we'll be beginning phase 1, 2A studies within the next week or two, actually around mid-July in Belgium and the United States, and around 1,045 patients. And that will give us information, again, in record time as to the immunogenicity and the safety and the reactogenicity of the vaccine. So we're very much looking forward to starting those.
You're talking about cooperation, but we saw Donald Trump talking about the vaccine, which should be first and foremost for the Americans. Yes, the translation is on. Can you hear me, sir? The translation is on. Yeah, can you hear me? Sorry. Yes, sorry. There is a slight lag between the switches. Sorry about that. On again. Thank you.
Can you please repeat that?
Répétez votre question, madame.
Martin FITCHET, on vous entend.
Yeah, it's okay. It's okay. Yeah, it's okay. It's okay. It's okay. It's okay. Speak, sir. Speak.
I did not hear Stephanie's question.
Okay. Oh, fuck this shit.
Oui, alors.
Yeah, you talked about collaboration. You talked about collaboration between labs, NGOs, and so on and so forth. Quite an unprecedented collaboration. But it is true that we saw Donald Trump trying to say that vaccine should be for the US first. We see competition between countries, each country trying to grab the vaccine. So how do you feel about that?
Yeah, I like the concept of thinking about the science, the diplomacy of the science, because that's going extremely well. The first thing we must do is create and develop and scale up and make available a safe and effective vaccine. That's number one priority. Whatever the conversations are going on around us, that is our priority. And if you think about it, unless we can actually create sufficient amounts of the vaccine, and we're committed to producing 1 billion doses in 2021, in production facilities around the world, that should allow for equitable global distribution. And I think it's a really important point that I've heard said before, and it merits repeating. You really have to treat every part of the world and make it safe for COVID-19, or you won't make the world safe as a whole. Unless you treat the whole world, unless you provide equitable access to the vaccine, you are not going to actually have complete global safety from the vaccine. We cannot allow pockets of infection and growing epidemics to continue in some parts of the world and not others, because the whole world is not safe until this virus is eradicated, until transmission is eradicated by a safe vaccine distributed globally.
Et vous êtes optimiste sur un vaccin?
So you're optimistic? You think we can have an affordable vaccine for all? One or several vaccines, actually?
I am optimistic. Now, with R&D, it's always a cautious optimism. We have to see what the studies show. Our vaccine is based on a platform, or a scientific platform, or a vector, as we call it, that we have a significant amount of safety data in. We also are confident in our ability to scale it up, but we need to do the studies. And the studies will show us, again, whether we do create the immune response and whether the vaccine is safe. And we'll have a conversation at the time with global regulators. And when the data permit it and the vaccine is approved, then we should be ready to implement and deploy worldwide, which is exactly why we're investing in parallel for a massive scale-up and manufacture of the vaccine, even before we have the data. So if the data are positive, which we expect them to be, then we'll be ready with the vaccine to deploy. So yes, I'm cautiously optimistic.
Et à grande échelle. Merci beaucoup. Gargee, GHOSH, vous êtes...
Thank you very much. Gargee, GHOSH, you are in Vancouver. You work for the Bill and Melinda Gates Foundation that represents $46.8 billion. So it's the non-state stakeholder that is the most powerful on the planet. So now that the US have withdrawn from the WHO, Bill and Melinda Gates are now the biggest contributor to the WHO. So do you think it's normal that a foundation be the largest contributor to the WHO? Does it not illustrate the lack of cooperation between states?
Well, thank you, first of all, for having me at Les Rencontres, even if only virtually this year. So this pandemic is a health and economic threat that has at once isolated us, and I think also shown us how connected we are. What's clear is that to overcome it, we absolutely need unprecedented international action and collaboration to do three things. First, to continue to slow the spread of the virus. Second, to minimize social and economic disruption. And third, to pave the way to vaccines, therapeutics, and diagnostics access for all. COVID-19, as you've said, has no respect for international borders, and so a multilateral approach to this is not just critical, but mandatory. We will not be protected until everyone is protected. Unfortunately, we are starting to see countries competing in a mad scramble to reserve vaccine doses or scoop up promising drugs like dexamethasone solely for their domestic markets. Such health nationalism may be understandable. After all, governments do have an obligation to protect their citizens. But in this case, such protection actually requires thinking globally. The world won't be able to bring this pandemic to an end if tools to prevent and treat it are auctioned off to the highest bidders or distributed without regard to who needs them most. Inward-facing solutions will only undermine efforts to stop global circulation of the virus, costing lives and prolonging damage to the global economy. And that economic damage could in turn undermine decades of progress for the world's most vulnerable. The latest IMF projections released just last week show the global economy shrinking at almost 5%, 2 percentage points below the April estimate. Per capita GDP in Africa, we know, is set to shrink almost 5%. The World Bank suggests that over 90 million more people will experience extreme poverty this year, and we know every country will experience a rise in poverty. But none of this can be solved in isolation. The strength of the health response will actually determine the strength of the economic recovery. But I also want to challenge the notion that cooperation has completely failed us. We've actually already seen impressive global
Elle est
collaboration,
insuffisante aujourd'hui.
particularly to accelerate the development of new diagnostics, drugs, and vaccines for COVID-19. Much more is needed, but it shows what's possible. To ensure access to emerging COVID-19 interventions happens as quickly as possible, we need a coordinated global response that does 4 things. First, accelerates R&D by many years compared to regular product development timelines. By
Ça veut dire
identifying
qui
and
autour de la
advancing the most
table?
promising
Pardonnez-moi.
Sorry, when you talk about cooperation, coordination, who do you put around the table? Private sector, civil society, everybody around the same table?
Let me give you an example of where we're seeing a lot of progress. Governments and institutions came together to launch the ACT-A Accelerator on April 24th. France, under the leadership of President Macron, kickstarted this collaborative effort, which was then supported by many countries and philanthropies and companies. We had a pledging moment on May 4th, and we launched a collective R&D strategy just last week. 3 particular partners I want to talk about. CEPI is the Coalition for Epidemic Preparedness. This should be the pooled mechanism by which governments share funding and risk to accelerate vaccine development and build manufacturing capacity. Gavi is a vaccine alliance represented by governments in all around the world, vaccine development companies, civil society, philanthropy, and they launched a procurement facility, the COVAX facility. This will be the mechanism that ensures global supply of COVID vaccine so that we can all get back to work in our normal lives. And the WHO is actually critical to this piece. They are working on developing guidelines for the allocation of vaccines based on epidemiological criteria that will speed up health progress in order to ensure economic progress. So absolutely, all these entities are critical to the solution.
Merci.
Thank you very much. Yvonne MBURU, Africa. Africa seemed to be spared by the pandemics, but actually I've heard that in some countries there have been a lot of deaths. How good was cooperation in Africa? Well, hello. I'd like to thank the organizers for inviting me. Well, in Kenya, we have about 7,000 cases. So there's been semi-lockdown with curfews, but the truth is we live in a paradox. There is no obvious epidemics, but we're still being hit and the effects can be observed. In Africa, when I hear what the other speakers said, the question of cooperation is very interesting. I'd like to say 2 things about Africa. We've had 2 things playing in our favor from the outset. The experience we have with infectious diseases, that has really been very important for us. We've had Ebola virus, and we've had Lassa fever, we've had malaria, and that we have the sort of institutional memory of these crises, and that has made it possible for us to be mobilized on a number of aspects. And we've also been fortunate enough to see the crisis reach us slightly later compared to other continents, and that has made it possible for us to prepare. There is strong cooperation in Africa. But of course, that's not the whole story. There are points to be improved. But if the institutional cooperation is what we're talking about, there's been strong cooperation around the African Union. And the current president, Cyril Ramaphosa, is the head of South Africa. He gathered all heads of state and governments to really face up to the challenge. He he mobilized very early on specific funds so as to address economic effects that are soon to be felt. So the approach itself is an approach that really is fully aware of the level of cooperation that is necessary. There's been a strong mobilization of the private sector as well. For a supply of drugs and medical devices, so that the purchase of face masks, testing kits, diagnostic tests and medical devices, so that there could be a cooperation around all of that throughout the continent and avoid competition that we've seen at play in some Western countries. And lastly, there's been a strong cooperation around Africa CDC, which is the public institution attached to the African Union. And it's made it possible to mobilize laboratories very early on because there were only some countries that had the capacity to test, but there were researchers from some countries, such as South Africa, that were mobilized to train healthcare professionals. And that cooperation should go even further. Yes, of course, scientific cooperation, because the challenges are even greater now. But I'd just like to say that there's always been talk about infectious diseases. There's always been some issues specific to countries in the south, and I'm glad that COVID-19 has actually put that in the bin, so to speak, because the reason why Western countries have tended to withdraw and some wanted to isolate is that what infectious diseases do to some countries. You know, the temptation is to close borders, and I think what was interesting to note is that the African continent has had the right response, whereas the Western countries were tempted to isolate. And when it comes to thinking on a global scale, when it comes to health, well, this is what global health is about, also about investing in health questions and in development. Well, Christian CLOT, it's interesting. What Yvonne MBURU has just said is really interesting. Shouldn't we look at health more globally? Shouldn't we invest more globally with more cooperation on health in the broadest sense of the term? We're not talking about a virus such as Ebola, which actually stayed contained in Africa. Now we're talking about a pandemic. Pandemics. Well, yes. Sometimes we separate the theoretical part from the in the field part, but it's humans that are impacted by viruses. Well, yes, talking about viruses, we used to think in Europe maybe that viruses came from Africa and stayed in Africa, but we've realized that viruses hit countries in the north. Well, and we've seen also that some ministers and prime ministers came down with the disease, Boris Johnson amongst them, or Justin Trudeau. It's a call to rethink and reinvent our relation to our world, our natural environment, and Yvonne MBURU said it. It's also a question of education. How can we get humans to understand and to rethink the way they relate to this new world? How can we actually engineer that education effort so as to mitigate that impact, so that the virus cannot grow and spread freely? And we have to be better prepared as well. And so, of course, you know, thank you for all the great work on developing a vaccine. But remdesivir is a therapy that is sold more than $3,000 per patient. So this is not what cooperation should translate into. So health should be accessible throughout the world. And Sylvie Briand, you're still in Geneva. Dr. Tedros, who's the head of the WHO, warned a few days back with in a divided world, the worst is to come faced with a virus. So is there momentum at the WHO for a reform right now? Yes. Well, at any rate, I think we need to set up those worldwide platforms to cooperate. It should be different from what took place when these UN institutions were set up. We need the contribution of foundations such as the Bill and Melinda Gates Foundation, but also NGOs to go beyond the health sector. We saw that the tourism sector, the transport sector were badly hit. So it is important in this 21st century world to look at health crisis through the prism of the 21st century and devise new ways to cooperate with new tools, because we now have the possibility to have video calls, and we have the technology to be the basis of a new cooperation. So we have to redefine, as Christian Clot was saying, we have to redefine health. It's not only about curative care, but preventative and also the root cause. Yes, it's a lot to be said for preparation. Preparation is absolutely crucial. There'll be more and more of those health crises because we are in a world that is more and more connected. So it's not only about new viruses, but new viruses tend to spread more than they used to in the past. So I think there'll be more crises such as this one, which is why it's important to be better prepared. And this preparation needs to be not linked to a specific virus, but we need to assess the vulnerability of our societies, be they rich or poor. How can we, as humans, face these crises? Martin Fitchett, do we need more investment, more public investment in health? How can we better prepare for new pandemics to come?
Look, if we think about, just take a slightly historical perspective, with the Spanish flu pandemic of 1918, which killed 50 million, we know that respiratory pathogens are going to continue to be very problematic for humanity. We can reasonably expect another influenza pandemic at some point, and statistically now perhaps additional in the future novel coronavirus breakouts. So right now we are working at unprecedented speed, levels of collaboration, at reacting and responding. But of course we can do better next time, and I think we will do better next time. And if we think about it, what we need to do is we need to consider how do we proactively invest in global health security, the concept of security as a planet. And the way I think about it is it has to be on multiple fronts. We should invest in the science of pandemic preparedness, of surveillance, the science of R&D, the vaccine platform science, the science of collecting data and evidence quickly and rapidly, much more so than today. We should fund the global bodies that already exist. I heard one of my panelist colleagues talk about CEPI and Gargee. These are fantastic organizations that catalyze epidemic preparedness across organizations, and also in terms of vaccines accessibility and procurement. We should make sure they're fully funded and ready to go at a moment's notice. We should also think very, very carefully about how we develop and invest in new trials and new capabilities to do clinical trials, but also how we work with global regulators in forcing a form of global harmonization from the regulatory space. So when we're ready, and when we have 1 week or 1 day is of the essence to get to, say, for example, a vaccine or a treatment, that there is harmonization of global regulatory bodies that will help help get the rapid approval worldwide and immediately of medicines under development. And I think one of the last aspects of preparedness, and sometimes it's overlooked, is we probably have to do a better job in educating the public around vaccines and having a more robust debate, particularly tackling the issues of vaccine hesitancy. Vaccines have been one of the, in fact, probably one of the most important medical advances in terms of public health in our lifetime. And there's still a large proportion of the public, I think, that we require, but we need to engage in debate to educate people about the value of vaccines. So taken together, I do believe that next
Comment
time
vous expliquez
around,
justement
How do you explain, Martin FITCHET, how do you explain that there are so much complex theories around vaccines today?
I mean, there are many theories around vaccines, some of which are based on more data than others. I think we just have to look at the facts and the data and allow the science to speak for themselves. In terms of the theories around the vaccines, look at what vaccines have done in terms of global disease burden. In my lifetime, it's been quite phenomenal. We almost take them for granted in terms of the diseases which we consider diseases of history. Hopefully, with vaccine development coming forward and the vaccine under development for the SARS-CoV-2 virus, hopefully we'll make COVID-19 also a part of history through mass vaccination.
Merci. Gargee, GHOSH.
Gargee, GHOSH. Now, Mr. Gates said, Bill Gates said we're not ready for the next epidemic. Taking at the situation of institutions still, when there was the outbreak of the Ebola outbreak a few years ago. Now, once again, how could we get everybody around the table? How could we better ready?
On n'était pas, manifestement.
Because we were not ready.
Thank you. I think we are learning very much what we need. We saw in the way we were able to respond to MERS, to SARS, and built some new capability. We were able to create, as I said, the Center for Epidemic Preparedness, CEPI, coming out of the last round, and that is helping us advance progress on tools faster than we otherwise would in this time. We do need systems of collaboration so that we are very quickly able to come together and agree medical protocols, supply protocols. We do need the WHO. That is a critical function. We need it to be operating at its best. And then we do need a way to very quickly agree how we pool our best scientific thinking and our best policy thinking about access to new tools so that when we do have the first vaccine or the first drugs, we do have an equitable process for thinking about who needs to get vaccinated first. Is that healthcare workers? Is that vulnerable populations? So we have a way of balancing, I think, the health and the economic recovery.
Qu'est-ce qui a manqué aux États?
Gargee, GHOSH, what was missing in the States, when Bill Gates said they were not ready? So what was missing? A lack of vision, lack of means?
I think there's so many pressing challenges in today's world. It's very hard to maintain focus on what could be. And a threat that could come. So I think that's a very human hurdle. We do need to invest in preparedness. And there are numbers to that, I think, of first and foremost surveillance. Yvonne mentioned the Africa CDC. That is a critical step forward in how we'll understand early indicators, early warnings of outbreaks and disease. So surveillance, tracking, testing capability is absolutely critical. We saw that in Ebola. We saw that we see that every day in polio. And then, as I said, the ability to come together very quickly to develop science and advance the new tools is the other piece that I think has been shown to be absolutely essential in our response.
Do you mean for the next outbreak we would need test kits, masks, facilities to isolate the first cases and so on and so forth? Is that the readiness system?
You know, I think there are multiple dimensions. First of all, we need data. We need the systems that provide us ready, quick information about health conditions that we're seeing. So epidemic surveillance is a critical first piece. The second, absolutely, the way we think about preparedness, supplies, and procurement has been demonstrated to be a critical piece this time and will need to be part of our preparedness plans. We also need to be able to think quickly about how we develop new tools and how we advance the science enough so that we are ready for what we know be the next likely epidemic to come our way.
Thank you. Yvonne MBURU, how can we draw lessons from the situation in Africa? You talked about a healthcare notebook, or kind of a trans-border healthcare notebook system. What would be the solution? Well, just to mention the healthcare notebook, this is mentioned for the African Council, Presidential Council, to respond to a healthcare challenge where there will be a strong community involvement of the communities. At one stage, we went to Senegal and to Guinea, and what really struck us was the fact that, well, there is Senegal, Guinea, Gambia, and the big Guinea-Bissau, and those are there are communities who live in trans-border zones. And to respond to the challenges, and the healthcare authorities have decided to create trans-border healthcare system. They will exchange information in Senegal or then in Gambia or elsewhere. I think the lesson to draw from the COVID crisis, and especially for the healthcare system, is that we need healthcare system that will meet the need of the people and not the opposite. That is, today we have a global world vision which is very vertical, which is able to respond to epidemics like HIV, tuberculosis, but what COVID has demonstrated is that what we were asked to wash our hands non-stop, because, well, we could think that putting drinking water. I'm sorry, we have a sound problem with the speaker. So we have to think about the healthcare system we create, because we have to be able to handle any sanitary healthcare challenge. And for that, we have to put the human being at the center and not. We're losing you. Sorry, we have to think about the human being, and to have this approach of healthcare indeed. To wash hands, but in some countries in Africa, there is no sanitation, no potable water. Christian Clot, finally, what's the final lesson to be drawn? Would you like to react to what Yvonne MBURU said about the way we see healthcare differently? As you said since the beginning, modestly, my lesson clearly, I fully agree with Yvonne MBURU. Everybody seems to agree to say that there will be more cooperation, more preparation. We are not enough preparation, but I think we have to stop thinking that healthcare is medicine. Medicine is a segment of healthcare. We talked about education, prevention, the way we look at the environment. I think today, in this will to create a drug, we should not forget ethics. We forget the human dimension. We set scientific rules in order to avoid doing just about anything. Otherwise, drugs or medicaments or drugs would become more harmful than the disease they're supposed to heal. So, we have to protect our lives. We have to protect the environment, and we don't want to do other medical laboratory-centric medicine and healthcare. When you take from disease, when you talk about disease coming from deforestation or climatic issues, this is what the Austrian doctor said. This is part of the issues, really, the exchange of link between man and nature. We need to better protect the planet. Yeah, of course, today we're going to be 10 billion on Earth. You know, we have a population density which is huge, and the environment is become rarer. So we have to talk about, stop damaging the environment and respect space. We need space. We need, borders have to be broken, really broken, so that we could have an exchange of information much better than what we have. Partitioning, working in silos doesn't help. So we need to reopen the world, and collaboration in Africa will have a key role to play. I do insist on this point, because the future it will be does it mean degrowth or, well, growth that has to take into account all the scope of ecology, or you can grow on sun power, on wind power, growth that be different from what we have today. We don't need to go into degrowth. Human beings have always wanted to grow, but there are ways to grow which are different today. So we see no contradictions between fight against climate change and the environmental issues and growth, I would say, social growth. Well, growth, I mean, a person who learns something is growing, not necessarily financial, but there is a form of growth. But a betterment, it's an improvement of the person. Sylvie Briand, do you agree with what Christian said? What could it be in the World WHO, thinking about the health in a more global manner? Well, I think first and foremost it is the OMS motto. We always said that health is a global well-being situation, physical, mental. So we are fully in that. We are in that logic. Work mainly on epidemics, on pandemics, and what's essential for us is to involve civil societies and communities in the fight against epidemics. I was surprised, and Martin FITCHET early on said that we need to educate populations. We'll have to move to the next step. It's not to you have to inform the population, but you have to you have to involve them into the solution. We have to decide about the solutions with the people. And I think this is what will help us deal with the future crisis, because outbreaks, because, I mean, viruses go from individuals to individuals, so the human interactions that are at stake here. So it's not just one person, but, we have the communities, societies have to think about the way they can do it and deal with it. And as you say, it goes from human to human, but also there could be also from animal to, so yeah. Well, we have close collaboration with the FAO, and we do have problems at the man-animal interface to try to achieve better management of this situation where, for example, there was a lot of discussion about markets. Should we close markets? But, markets are sites where people buy food, and to have access to a market, it's also a place where they can actually feed themselves and get money. So in all the measures we may implement in public health care, there will be an impact on social life, and therefore we have to find the balance between the benefits for healthcare and the benefits for society as a whole. Does it mean more drastic measures on the markets, for example? Well, we need to understand how transmission is done in markets, because for the time being we haven't found the intermediate anymore. So we need more science to try to. So the pangolin is indeed was the host of the virus, but with cats, Weizen, and and so we're still looking for the other, and then we'll take measures. But we'll find measures. We will focus on one real problem and not some kind of closed markets for unknown period of time. Martin FITCHET, you talked early on a minute ago about regulations, because we are in an exceptional situation with COVID. Now, does it mean that regulations about vaccine from various countries could be applied in a softer way or not so stringent way?
No, I'm not saying that, and I don't think that's a good idea. I think we still have to have strict regulatory oversight because safety and efficacy is paramount, particularly safety, because with vaccines, you're administering the vaccines to, in this case, billions of people, potentially healthy without the disease. So safety is paramount, and of course, efficacy is critical as well. So we shouldn't have a less stringent regulatory oversight, but we should think about ways we can harmonize regulatory guidelines, that we can ensure that regulators can work together, that regulators can recognize other regulators' decisions, so we can rapidly get approvals worldwide and deployment to the people who need them. So I think regulatory harmonization is important, but I would also like to say, really to come full circle on my comments at the beginning, the level of responsiveness and engagement by global regulatory authorities has been astonishing. I mean, we are in real-time discussions with regulators. They will respond to within the day. Everybody is taking this extraordinarily seriously, including global regulatory bodies. But I do believe that we could think about, once we're through this and once we have a safe and effective vaccine deployed, could there be better regulatory harmonization to ensure that that is not a rate limit in the process? So far, it hasn't been.
Don't you think that the fact that people have gone too fast, this could have led to mistakes?
Well, I think whenever there is an unprecedented acceleration like we have now, we have to be very, very careful that we don't make mistakes. And we just have to make sure that our oversight is stringent, that we observe the highest levels of quality in R&D and also in manufacturing, which is exactly what we're doing. So we just have to ensure that doesn't happen. But we do have to move very, very quickly here. If we think about the human toll, which is really significant, as well as the economic toll, where there is an urgency, and there is an urgency on the part of everybody involved in this process and vaccine development, not just the R&D companies, and governments and regulators and procurers and manufacturers. And I think we're showing through collaboration that we're working extremely well together. So urgency and speed doesn't necessarily need to, and it will not reflect poor quality.
In China, from what I've read, they were going to test a vaccine on military staff. I mean, don't you think that they're going a bit overboard?
I can't really comment on. Was this question for me, Stephanie?
Okay. In China right now, can you hear me, sir? Yeah. Okay. In China right now, they. Okay. Yeah. Okay.
I'm not sure of the veracity of them. I'm not sure what's happening. We will observe the highest ethical standards in our clinical trials, whether there is a significant global urgency like there is now or not. Very high ethical standards must always be observed in clinical research. And so that is non-negotiable.
Merci beaucoup.
Thank you very much. Gargee, GHOSH, one last question by way of conclusion. At the Bill and Melinda Gates Foundation, you are always focused on vaccine. Now, this time, do you think that you could draw lessons from the previous vaccine processes? Do you think there will be a vaccine accessible to all? Is this what you're saying at the Gates Foundation? And of course, safe one.
Thank you. So we are very focused on vaccines, but I would say diagnostics, therapeutics, and vaccines are all going to be important. And of course, the goal is as soon as possible, access for all. It won't happen all at once, and we need to be thoughtful about workers, vulnerable populations, but of course the goal is equitable access for all. I do want to just close by emphasizing the comment that several other panelists made, that really, in addition to sort of COVID-specific response, for us, this has really demonstrated the criticality of basic health services. And we are in a situation in many parts of the world where deaths from non-COVID causes, interruptions in regular vaccinations, interruption in regular maternal health services, risk overwhelming even COVID deaths. And this is a demonstration of how important it is that basic health system, primary healthcare systems are invested in and are the basic protections for populations around the world.
Merci. Yvonne MBURU, peut-être que vous voulez réagir là-dessus.
Thank you. Maybe you want to react to this.
Pas, lorsqu'on ne travaille pas, on ne ramène pas.
Well, when you don't have a job, you can't earn a living. So how can we face these problems that go way beyond the mere COVID crisis? I think that what's extremely important is to have international cooperation amongst countries that will make it possible to go beyond these challenges, whether it be a new form of pandemics or not. In Africa, it was very complicated to have a lockdown, same as in Western countries. And it was important, of course, for scientists to be able to do their work. And there is a need for real sharing of scientific information. I think it's been said by one of the panelists. There is a need to promote open data. The more countries share their data, the more we can build our responses on the basis of the data. Beyond this, and beyond the COVID context per se, we're forgetting about some diseases that are still very important. I'm thinking that as we focus on COVID, maybe we are not pooling enough resources on some teenage pregnancies or other diseases or pathologies. So we shouldn't put all our eggs in the same basket. So we have 5 minutes left, and I see we have a question by one of our followers on the net. How can we ensure health everywhere? It's not only about bringing healthcare professionals from elsewhere, but about strengthening local capacities. Do you want to take this, Mr. CLOT? Well, yes, but I think globally what we can say is that there's no sufficient budget to study all the human paradigms in a crisis situation and how we can really get those paradigms to change and our responses to change. So I think we need to really tackle these problems way beyond the medical issues per se. We have to educate the general public, as Martin FITCHET was saying, but I think we need to really involve everybody. There'll be 10 billion brains on Earth, and all are as capable one as the other, and that's how we can find the right solutions. Gargee, GHOSH, do you concur that there's a need to strengthen local capacities and the training of local health professionals?
Oh, absolutely. If you think about how most families receive healthcare. It is local workers, village clinics, and so, you know, some of the work we've been very focused on is building the capacity of primary healthcare systems in Bihar and Ethiopia and in Nigeria, because we find that community health workers armed with support from diagnostic clinics, reference clinics are really among the best ways to support the basic health needs of the most vulnerable populations.
Voilà, donc ça se passe au niveau local.
So health is also a local issue, but also a global issue and not merely a national issue. Many thanks to all the speakers for taking part. Many thanks to Martin FITCHET, Gargee, GHOSH, Yvonne MBURU, Tilman, RUFF, Sylvie, Christian, CLOT, and many thanks to all the people who followed us online.